health issue our group will be covering is the cholera crisis that has emerged in Sudan amidst their ongoing civil war. Before we begin, though, you might be wondering, what is cholera? Well, cholera is a severe disease caused by the bacteria Vibrio cholerae, which infects the intestine. If left untreated, it can cause death due to severe dehydration. Common symptoms include diarrhea, vomiting, abdominal cramping, and dehydration. Our CBC Radio article describes how the cholera crisis has worsened because of the conflict. Millions are displaced and living in overcrowded camps without access to clean water or sanitation. Aid workers report that people are forced to drink unsafe water, and seasonal flooding has contaminated wells and rivers. Health officials have launched vaccination campaigns, but the ongoing conflict, poor roads, and limited funding make it difficult to reach those in need. Therefore, the article highlights how war and displacement creates the perfect condition for cholera, leaving families, especially women and children, in desperate need of clean water and health care. Why should we care, though? Well, as future healthcare providers, this crisis reminds us of our responsibility to promote global health and well-being, especially for vulnerable populations. For nurses, this can mean advocating for access to clean water, proper sanitation, or medical care, as well as educating communities about disease prevention. These actions are essential parts of our role, particularly during times of crisis and conflict. Our first peer-reviewed article focuses on how the cholera outbreak spread in Sudan during the ongoing conflict. To start off, the researchers used surveillance data, interviews, and state reports to track how the outbreak began and moved through communities. They found that it started in a border village near Ethiopia and spread quickly through contaminated water sources. Because of the conflict, many people were displaced and access to clean water and sanitation became extremely limited, which made it difficult to control the spread. However, once an oral cholera vaccine campaign was launched, cases began to decline. Overall, the study shows how quickly outbreaks like cholera can spread during times of war and highlights the importance of preparedness, surveillance, and community-led response. Our second article takes a broader look at why these outbreaks became so severe in conflict zones. It explains how war can destroy water systems, sanitation infrastructure, and healthcare services, leaving displaced populations especially vulnerable to diseases like cholera. The article also focuses on the role of healthcare workers. It showcases how they help manage outbreaks, provide care, and educate communities, as well as collaborate with humanitarian organizations to reduce the impact. Overall, it emphasizes that strong coordination, better infrastructure, and support from healthcare workers are all essential to controlling cholera in these crisis settings.
The CBC piece uses a social justice advocacy approach to present the crisis in Sudan. The report frames the cholera outbreak and unsafe water not simply as a medical crisis, but as a human rights and social inequality crisis. The focus is on the moral responsibility of the international community and the urgent need for humanitarian aid, showing compassion toward those suffering due to poverty, war, and displacement. The article presents the cholera crisis as an outcome of flawed political and social structures, civil war, sieges, restricted humanitarian access, and underfunded aid. It highlights systemic responsibility, quoting humanitarian leaders calling for donor action and policy change. Language such as "this cannot continue" reflects advocacy journalism that exposes inequality, power imbalances, and institutional failures. The article also includes first-person human-scale details: a mother preparing food, a patient on a bed, people drinking from contaminated wells. These moments emphasize lived experience and how people perceive and endure the crisis. Vivid imagery like crowding, rain-contaminated wells, and disease grounds the reader in the human cost. Cholera is framed structurally as a result of overlapping crises: war, displacement, and damaged sanitation. The story humanizes these conditions through personal narratives while using case data and death tolls to show scale. It also focuses on the response vaccine campaigns, aid efforts, and funding shortages. By linking the disease to social collapse, readers can see that the technical fixes can't alone solve the problem. The advocacy lens builds moral urgency and highlights accountability, showing that suffering results from political choices. It also integrates public health and humanitarian perspectives, helping readers understand both data and context. Because of its advocacy tone, the piece leaves less room for complex political nuance or technical depth on disease control. It does not explore local governance or detail specific prevention strategies like surveillance or sanitation systems, limiting the picture of long-term solutions. Including local health workers and community leaders would reduce the outsider speaking for locals dynamic and add cultural context. Epidemiologists, or WASH, which is Water, Sanitation, and Hygiene Specialists, could clarify how cholera spreads and which water treatments are realistic in camps. Humanitarian logistics experts could explain the challenges of aid delivery in insecure regions. These voices would strengthen both the accuracy and balance of the story. These perspectives would balance the discussion connecting the structural causes of cholera with the practical, on-the-ground efforts to save lives and restore hope in war-affected communities.
The news article centers on humanitarian organizations' reports, giving them authority over the narrative, whereas the scholarly article similarly prioritizes humanitarian and expert voices, as well as rapid response teams, RRTs, and state or national health officials, with some inclusion of local Sudanese, for example, state-level staff. The outbreak narrative is told through institutional and technical perspectives, leaving out the lived experiences of everyday Sudanese people. This demonstrates how articles unintentionally overlook the realities of those enduring the crisis firsthand, and how authority is given to experts rather than those living the crisis. The most marginalized groups in this discussion are displaced Sudanese people living in internally displaced persons (IDP) camps. The conflict disrupted health services and response coordination, worsening the crisis for these groups. As the peer-reviewed article notes, the number of internally displaced persons (IDPs) is estimated to have reached 10 million. These communities lack access to clean water and sanitation, making them especially vulnerable to cholera, which spreads through contaminated water. Their experiences are described indirectly through data on displacement, infrastructure, and water access, rather than through their own words. This demonstrates how the ongoing conflict deepens the health crisis and limits effective intervention. Additionally, the article and news coverage both fail to address the role of privileged groups such as Sudan's political leaders, whose decisions directly affect the crisis, as well as government accountability in the outbreak. Including their perspectives or accountability would provide a more complete picture of the systemic power imbalances at play. This connects to the nursing concept of cultural safety, which emphasizes recognizing and addressing power imbalances at all levels of care and centering the community's perspective of safety and care. Broader inclusion of affected civilians' voices and local leadership could provide a more culturally and socially grounded understanding of the outbreak.
Nurses play a vital role in containing and treating cholera outbreaks. They care for patients with cholera by ensuring adequate fluid and electrolyte intake through oral rehydration. It is recommended that adults have more than 6 liters a day. According to OGIN, with cholera, about 50 to 70% of patients die due to dehydration, and about 80% can be treated with basic oral rehydration. In more severe cases, IV rehydration therapy and antibiotics such as fluoroquinolones, tetracyclines, and macrolides may be used. It is generally better to distribute antibiotics to everyone who has cholera to prevent antibiotic resistance, but that may be difficult at times due to medical supply shortages during armed conflicts and humanitarian emergencies. Nurses also work with organizations such as WHO and UNICEF to prevent the spread of cholera. According to the OGIN article, nurses can train volunteers to help with treatment and teach communities about disease transmission, explaining early warning signs, rehydration treatment, and how to purify water with chlorine tablets or by simply boiling it. By demonstrating and explaining the importance of these practices, nurses are able to reduce the spread of cholera and intervene quickly. Due to war and conflict, government resources can be directed away from public health, which makes it more difficult to advocate for hygiene and sanitation facilities. However, it is important to advocate for these systems as well as deploying vaccines and hygiene kits while also breaking government stigma about having cholera in the community to allow for quicker intervention. Furthermore, nurses can support vaccination campaigns for oral cholera vaccines as well as fundraising promotes awareness and, of course, research to discover more ways to stop such outbreaks.